As GPs, we're doing more and more and more for our patients as services that would traditionally be in secondary and tertiary care get pushed back towards us. We haven't unfortunately got any longer days or any more hours in our day, so we need help with that. And advanced practitioners can provide a really important role in allowing us to achieve it. So an advanced practitioner here at Portishead Medical Group is an advanced nurse practitioner, and we have 2 of those, one of whom is Anna, and we also have another member of staff. So they work in parallel with the GPs seeing patients on a day-to-day basis. Patients can book into them directly, and they will see a relatively broad spectrum of problems, rather like a GP would.
Our advanced practitioners really do help us with capacity management in the practice, not just because it gives us additional appointments to offer to patients, but also patients really like being offered an additional type of appointment to a GP, so they may not want to bother the GP. They may not have been sure whether or not they should be phoning us, so they feel very reassured to be able to see an advanced practitioner. And they get the same service, they get the good advice, they can get the prescription if one is needed, and they can also get a little bit longer. The appointments are typically a bit longer with the advanced practitioners, so they are able to perhaps talk to the patient a little bit more about anything that's worrying them.
Having an advanced nurse practitioner at the surgery diversifies the skill set that we have within the surgery. My base qualification is as a nurse. I will never forget being a nurse, and I've bolted on my additional skills to be able to look after patients in a single consultation. So bringing that skill set together means that the practice will have additional skills.
So they participate in a lot of the other things that go on in the surgery to really enhance the overall clinical service that we provide. So for example, they join in our clinical governance meetings and significant event reviews, because not only can they represent the clinical side that we're talking about with the whole clinical team, but they've also got those additional experiences from their backgrounds. We've also found advanced practitioners incredibly helpful with providing training and coaching for our nursing team, but also sometimes for our GP registrars as well. So we've run some incredibly popular training sessions for the nursing team where the advanced practitioner has come through and gone through, say, paediatric care or emergency care, and they were really, really popular.
So having had advanced practitioners as part of our team now for many years, I can't see us ever being without them. They form a valued part of the team.
Here at Portishead Medical Group, we have been pretty fortunate. We've generally been able to find a great candidate every time we've advertised, but we would love there to be more in the system. We'd love there to be more training and more people coming on stream, basically, because it's an area that's only going to grow. And as the demand for primary care grows, we want as many as we can get in to join our team.